There's no reason for people in a society as wealthy, resourced, and technologically advanced as this one to not be thriving. Every crisis we are exposed to hourly is completely predictable and preventable if we connect to a shared vision of everyone thriving. Surviving the day is just not acceptable anymore when we know that thriving is actually possible. Welcome to the 100% Future podcast, where Dr. Katherine Ortega Courtney, Dominic Capello, and me, Rubina Cohen, as your host, share insights, action plans, and inspire you weekly to take bold action in designing thriving communities for all. Okay, welcome back, everybody, to the 100% Future podcast. And I'm back in the studio with Dr. Katherine Ortega Courtney and Dominic Capello. Welcome, guys.
Hi.
Hey.
So today we want to dive into the social determinants of health. And Dom, I think you're wanting to kind of jump in here with that. So I'll let you begin today.
Well, the world of public health is a pretty interesting world, and I worked in it for many years. And when you work in public health, you are introduced to a concept called the social determinants of health. And many people, when they're hearing that phrase, think, what the heck is that? I mean, you can't immediately figure it out. And yet there's a simple way to say, we know what determines our health, our education, and our overall quality of life. So if you think about the social determinants of health, you're talking about what will determine the future of our children, as well as our adults. Mm-hmm. So there's a whole area of study. It actually goes back centuries, believe it or not. There have been countries looking at the impact of services and environments on health. But really, I would say since the 1970s, here in the States, coming from research that came over from Western Europe, really kind of packaging it as the social determinants of health. What does it mean? What does it mean on the ground level? Does it mean, a community that has no services, and we're going to describe them as the adverse social determinants of health? It's adversity. Or are we going to be looking for communities that are really well resourced, where services are very accessible? Then we're talking about the positive social determinants of health. So I know it's a lot to take in, adversity versus positive, but at the end of the day, the question we ask is this: what determined 8-year-old Anna's life? That's where we have to go. What is determining the quality of life of our children and our students and our families?
And for those of our listeners that are jumping into this episode first, let's just quickly tell them who Anna is. And I'll let Dr. Katherine talk about that.
Yeah, so Anna is a fictional character. She was the main subject of our first book, Anna, age 8. And she is based on real cases that we saw while working for child welfare here in New Mexico. And Anna's story is basically that she was born into a house that had a lot of struggles. She was in and out of foster care her entire life until she was returned home one last time, where she was killed by her mother at the age of 8. So Anna is kind of a symbol for us of, let's not let this happen again. And, let's learn from this and talk about what we can do to prevent this. Social determinants of health, to me, when I first heard about it working in child welfare and in juvenile justice, basically is the idea that where you're born and where you grow up predicts your outcomes. And to me, that is terrifying. Why should it matter where a kid is born? Shouldn't everybody have the same opportunities to thrive and survive regardless of where they're born. And it's deeply important to me as someone who grew up in Espanola, which is a place that is very, adverse social determinants of health, if you want to call it that. And as someone who grew up in a healthy household with parents who were, very supportive and wonderful, but still in a community that struggled, and how that impacts you regardless of what kind of household you're in. So for us, it's always both together, right? There's what happens in the home and what happens out of the home. And in New Mexico, unfortunately, a lot of our kids are facing both ACEs at home and adverse social determinants of health in their community. Mm-hmm. And so we need to address both if we want to turn around our outcomes of, being famously 50th for child well-being year after year, according to the Annie E. Casey, what is it, Dom?
It's the Kids Count report.
Kids Count, yes.
Yeah. Thank you. And we can put those links in our show notes, and we will also share a link to the book, Anna, Age 8, that was authored by Dr. Katherine and Dominic, and we highly recommend picking that book up and reading it to get a deeper understanding of what we're talking about. So now talk about the 100% New Mexico initiative a little bit. How does that start to take, looking at both of these, and how do we start moving into creating the right solutions for not just surviving, but thriving in our communities?
If you look at, kids with ACEs or kids who grew up with ACEs, some of them end up okay, and some of them don't, right? And what's usually the key difference is really comes down to access to support, access to resources. So if you look at a community where a kid goes to school and the school can see the kid is struggling, and they surround them with support, and they make sure their family has food to eat, and they're in a stable house, and they have access to medical care, the outcomes for that kid are much more likely to come out, this kid's going to graduate and go to college and have a successful career, versus a kid who's struggling at home, goes to a school, flies under the radar. They have no resources to support that kid. The kid continues to struggle, gets labeled as a kid who's acting out, gets kicked out of school, and, ends up on a different path. What Dominic and I found is, these access to resources that we talk about so often are not available. And if they were, it would be a game changer. So our goal is very simple. Make sure that 100% of people who need them have access to 10 vital services for surviving and thriving. And that's the goal of 100% New Mexico. And by doing that, you both prevent ACEs, and social determinants of health are turned into positive ones. So I'll let Dom talk a little bit more in depth about what those services are, but basically it boils down to access to resources when they're needed.
Right. When we were writing Anna, Age 8, we talked to a lot of colleagues in child welfare. We talked a lot about, services that would make a big difference. And they would share, because they're meeting with parents in the system all the time. They talked about, these parents, they can't get to behavioral health care. They can't get to medical care. It's a long list. And I think for middle-class people, we have access in general, and we don't think about not having access. It doesn't even enter our mind, of course. Now there may be waiting lists, and sometimes there are little glitches, but in general, who doesn't have access to the services for thriving? Well, as it turns out, in New Mexico, depending on the community where you live, a third to half of families can't get to these services. So the 5 services for surviving, you have to have access to medical care. You have to have access to behavioral health care. Also food security programs, food pantries, and also affordable housing or programs that help you get to safe and affordable housing. And the 5th survival service would be transportation. We learned that in New Mexico, many families struggle to have reliable transportation, and there's very little public transport. So these are the 5 services for surviving. Now, we would like to talk about thriving all the time, but you can't get to thriving till you've addressed surviving.
So there is a pathway to getting there.
There is a pathway. No, it's not always linear. It's not always linear. And sometimes, people are very creative. They miss all these services, but they get to these. But the thriving services for families would be, first, parent supports, meaning home visitation, parent education, parent workshop. There are all kinds of things that parents really benefit from. Parental leave. There's a lot to talk about in that world, and this is not available to many, many, many parents. The second thriving service would be early childhood learning programs. There's decades and decades of research on what happens when you get your child into a quality program, and it's incredible getting kids ready for kindergarten, ready to be social, ready to read, not ready to read, loving to read. So there's that. The third service would be community schools. And community schools are different from most public schools in that they have more resources. They have a philosophy of really making the school a learning center open to the entire community. It's beyond academics, although academics are very important, but it's much more than that. And community schools are incredibly important to us. And that's a whole other conversation, but community schools, and then of course, youth mentorship. We know that people do well with mentorship, people of all ages, but especially children and teens. Having that trusted mentor. A lot of our kids are in struggling families. Parents are working 2 jobs. They don't have the energy or the resources to be there as much as they would like to be. But a mentor, like Big Brothers, Big Sisters, that has decades of research behind what happens when you get into that program. And lastly, job training. We're living in a world where the workforce is changing every day. The needs are changing every day. Parents need access to this vital service. And there's a lot, as you can imagine, these are 10 vital services, all with their own research, their own politics. There's a lot to talk about here, but essentially, if these 10 services exist, families do better.
Amazing. And okay, so I think I'm going to ask a question that I'm kind of hearing our audience asking, and so I'm going to put voice to it, which is there are services like that in our community. Like you mentioned, Big Brothers, Big Sisters, or I know Las Cumbres Community Services does a lot of early childhood stuff. I know, we have our community schools that they don't exist maybe in the way that you're thinking they need. So what's missing? Why aren't these services that do exist not addressing this larger problem that we see in our community, and how are they not addressing it?
It boils down to access. So, there are so many amazing organizations that are doing amazing things. Families who are struggling might not know about them. They might not have a car that can get them to those services. Those services might be open while the parents are at work, or while the kids are at school. And so that is why our initiative starts with a survey. We ask the parents, have you needed these services? If so, were you able to access them? If not, why not? What were the barriers? And our reports are available on our website, which we can link to. But they show very clearly, a large percentage of our families who need these services, even if they are available in their communities, might not be able to access them for a wide range of reasons. And identifying those reasons is absolutely key. I think when we started the initiative, and we still hear it sometimes, it's, we need access to 10 vital services. And they will say, well, we have that. We already have the service.
Yeah, exactly.
But when you talk to the people who need the services, it's a different story. And we learned that at CYFD, like Dom said. listening to caseworkers say, you know, this parent needs this and they can't get to it. Or, you know, this parent needs behavioral health and the waiting list is 6 months, you know. Just because a service exists doesn't mean that it's necessarily accessible.
So it's access. It comes down to access. And how is the 100% New Mexico initiative filling that gap?
That's a great question. We have a process. It's a 7-step process. This would probably be a much larger conversation, but the short version is this. It starts with community people coming together and acknowledging the problems. As we said, you start with a book club just to see, are we on the same page? Are we willing to admit that we're not providing all the services to 100% of families? So you have to start there.
It's a simple first step, but it's a significant first step.
It's just sharing a vision, because you're sharing an understanding of the problem, but then you're sharing a vision of the solution. Now, how you get to that solution is an interesting story. But as Katherine said, the first thing we have to do is survey our parents, county by county. Do you need the service? If you do, can you get to it? If you can't, what are the barriers? So that's really the first official step when you're in our initiative. Once you've said, please come in and let's partner and work on this. And then with the survey, we learn a lot. Surveys are fascinating. And you have to analyze the data. You have to look at the numbers, and you have to look at the barriers and to see, well, what's the number one barrier to behavioral health care? You know, what's the number one barrier to food security programs? So analysis of the data, looking at that report, that's step 2. Step 3 is, and this happens within a county, is that you have to talk with your providers. Now, we're talking about 10 vital services. There are providers in all those services. I should add, many of them never talk to one another. They're very siloed, but they all have a relationship to one another, but they may not know it. They're serving the same families. So you have to talk to these providers and you have to ask them. You have to go to a behavioral health care clinic and ask the manager, well, how are you doing here? I mean, do you have enough staff? You know, what is your waiting list and why? What kind of help would you like? You have to get to know why those barriers exist, because you want to know their perspective, not just the perspective from the families, but you want to get a much bigger picture. So you do that survey, the survey of providers, and then that leads you to creating what we call a family services directory. Now, there are many directories out there, like Share or 211, or you could just go to Google and say, you know, behavioral health care in Santa Fe, and options will come up. So it's a long conversation in 2023 about using technology to create directories, but it's still a challenge with many of our counties. And especially when you say, when's the last time this was fact checked? So there's that project. But what's nice about getting the directory up, and many of our counties have done that, is now everyone's on the same page. It's like, oh, in San Juan County, we can see how many behavioral health care providers offer sliding fee scale. You know, we now know what we have. And then from that, our teams, and I should mention that in our initiative, they immediately developed 10 action teams, each one focused on one of the services. So you've got 10 teams working, and they're working together. You know, they're all in the same room, or at least on the same Zoom call, and talking about what they're learning. And that's important, because the people in behavioral health care need to know the people in transportation, because people can't get to mental health care because they don't have a car. So there's a lot of interdisciplinary, intersector conversations happening. And so these teams then do the research. You know, we are a data-driven organization. We don't base things on a hunch. You know, we base it on, have we done the research?
Yeah.
You know, let's look at that. So in transportation, who's figured that out? Is it subsidized Uber-like ride sharing? Is it a new way of using artificial intelligence to design new routes for van services? I mean, the good news is this: there are solutions to every barrier. Our people have to research, and we help them. We have a lot already identified, but there's research that goes on looking for innovation, and technology is a big part of this. And from there, then you go to the funders. And the funders are city government, county government, state government. There is philanthropy, of course. There is the federal government. The issue isn't whether we have funding to remove barriers. The funding is all over the place. Not talking billions and billions of dollars. The problem is the priority.
Yeah.
Are children the priority? Thus far, the answer is no, but that's changing. Our initiative is going to City Hall, presenting to the counselors. And also what's kind of cool about our initiative, some counties have city councilors, county commissioners, a mayor pro tem in the initiative. So they're already on the inside, but funding is huge here. And we believe that government, one of the roles of government is to leverage their power and their partners to make these services available. We're not saying they have to fund all the services. What we're saying is leverage your power, Mr. Mayor, because you can make private public sector partnerships happen. Or Ms. Mayor, as the case may be. And from there, our last step, but these are 7 steps, I know I'm kind of running through them, it's evaluation.
Yeah.
Are we making a difference? It would be very easy to get really good-hearted people together talking and convening. And you do need that, but you have to move from that to action. And
absolutely.
I think our people have done a good job of doing that, and we always have to be talking about that. And so we have what's called a quarterly update. So we have an outside evaluation team that is talking to every county initiative and checking in with them to saying, how are your action teams doing? Are you developing a 100% family center, one-stop service hub? Are you developing community schools? So again, long-winded answer, but those are the 10 services, and those are the 7 steps to get those services for 100% of families.
Awesome. No, I think that was really important for our audience to hear, because we're going to be getting deeper into each one of those vital services as we continue to meet each week to discuss these topics and teach and share even more and inspire every single week. I think one of the things I would love to kind of, just kind of say out of observation is that we're not just talking about, band-aiding again. We're talking about a systems change here. And so, when we talk about like, why don't people have access, or why can't these organizations just give the access to all these people? It's just not that simple, because they're operating within a system that has not really given them the container and the format to be able to do that. And what I really see 100% New Mexico Initiative as is that container and format to be able to create that larger systems change that will allow this to grow into the norm of how children and families and communities are engaging with each other and getting to that place of surviving and thriving. Anything more you want to add, Dr. Katherine?
I think you summed it up beautifully with that last statement. That is exactly our goal.
Yes. Okay, awesome. So thank you, everybody, for being here again today with us. We will be linking to all of the things we talked about and mentioned in our show notes. Our website is 100nm.org, and we will see you next week. Thank you.
Thank you.
Join us on the road to 100% New Mexico Initiative at 100nm.org to learn more and get access to the podcast show notes. Want to stay more actively engaged with the movement? Then follow us on Facebook at 100% New Mexico and on Instagram at 100%NM. Until next time, let's take bold action to create a 100% future for all.